make sure you sanitize. I don't want none of what y'all got. Listen, let me tell you something. What a time to be alive right now. You know what I'm saying? I know. Listen, we gonna catch up soon. But listen, what I wanted to talk about was this crisis, epidemic, pandemic situation we got going on right now, because shit is getting real. If you don't know me, now you do. I'm the Urban Nurse, you know. Been a little hibernation hiatus for a little while, but since this corona situation been going on, I said I got to come out of hibernation and give some relief, you know, settle some nerves for my people out there. Because I know my people wondering, and y'all don't really get to see what's going on the front line like I do, being as though I'm an emergency room nurse. So I just wanted to give y'all this COVID-19 coronavirus situation from a nursing perspective. It was all good just a week ago. It was all good just a week ago. Everybody making jokes and memes. I didn't think it was a big deal myself for a very long time. I'm like, oh, it's just another flu. People just getting flu-like symptoms. It's only affecting like children, I'm assuming. Only high-risk population, so children, the elders, people with a lot of comorbidities. I was like, oh, this will pass. At first, it wasn't, oh, that's just a China thing, or that's just across the country in other countries. Then when it touched down in the US, and the quick time span it took to spread throughout the US, I'm like, oh man, this getting serious. I just want to say, everything is canceled. I was supposed to be in Panama and Colombia for the next 2 weeks, but I'll be sitting at home because I'm not getting stuck in another country. I'm not getting stuck in another country. I don't want to deal with any of this COVID travel, putting myself in harm's way, being around somebody that may possibly be sick, or you know, somebody that may possibly have it. So I had to cancel my trip. And it's just been a lot with this situation. So I'm now really starting to realize, like, it's getting real out here. So I wanted to kind of give you the good, the bad, the ugly of everything that's going on. First, I would say the good. Listen, hide your kids, hide your wives, because they paying everybody. Listen, they just giving away money. All these travel agencies, I mean, the money is flowing. So if you are ER nurse, ICU nurse, med-surg nurse, infectious disease nurse, listen, get in contact with my people at Emerald Health so they can get you right. I will be going to New York next month because it's such a high infected population of confirmed COVID cases. I will be going to New York to become a travel nurse for 8 weeks to work. I don't know with the hospital. I don't know the details yet. But when they gave me that pay package, listen. Listen, when they start showing that money, all this stuff going through my head. I'm like, they're giving upwards of $3,000 to $5,000 a week for rapid response, crisis, high needs nurses right now in places like New York, Boston, California, a lot of places where the patients with COVID-19 or the suspected cases are high. Now y'all know in ER, it don't never stop. You know, I thought when the corona came to the US, it was going to be an influx in sick patients and everybody was going to be coming to the ER because either they thought they had it, they had symptoms of it, or because they had it. So I thought my life was going to be hell for the next 30 days. But actually, let me just give you guys a little insight to my day since the COVID-19 has happened. Check this out. When I came to work and I saw this is when I knew, oh shit just got real. each of these tents are set up for a triage area, a testing area, and then for people that are actually positive for the COVID-19 to be treated and then sent home for self-quarantine. Okay, so this is the initial treatment tent where patients will get, you know, blood drawn, do flu swabs, and basically triage them. So this triage area, get the lab work, get everything printed up, send it off, and then leave out of this. And this is the live isolation tent for confirmed corona patients or patients that fall under the criteria for possibly being contagious with the coronavirus. Got everything in here. We got the code card, we got vital machines, a little waiting area, got our printing stations, our vials here, this discharge area. And this is equipped to house 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12 people. So I just wanted to give you guys a quick inside view of what it's like if you got corona. Because this is where you're going to be at. This is where we do all our blood work, you know, supply closet. This is our clean utility room. You got everything you need. And this area, if you can see, these fold down. Once you bring these down, this becomes like its own isolation room, and this is where we will do all our codes at if necessary. And this basically is negative pressure. You can see it's air flowing through there. This is a negative pressure room, and everything in here has to be decontaminated, and that's why we close these off, so we don't interrupt other patients or you know, put other patients in danger. Yeah, that's it. So, you know, now that you guys have got a look in the inside of what an actual testing tent is going on, an actual testing tent at a facility, they're trying to keep everybody from just coming in the inside and, you know, separating the sick from the not so sick. With these high needs, we need staffing. So I know at my facility that I'm doing a contract at right now, they're giving the staff nurses an extra, I want to say like $20 or $25 an hour to work outside for, I want to say 8 hours or so. But, you know, they're trying to get people to come in. They're trying to stay prepared. You know, I can see things starting to grow in the upcoming weeks and or months, where more people will get infected, or more people will become symptomatic and come into the hospital to be tested or to be seen. But it is weeding out, ever since everybody's staying home, all the nagging chronic issues that people deal with on a daily, or from not taking care of themselves, or just coming in. Because I think sometimes people just come in because they need friends, they want to talk to people, and they lonely at home. So everybody's staying home, which is making it for real emergencies only pretty much to come to the ER. I'm seeing you know, real sick patients, and not patients, oh, I came in because I got a headache. I came in because my stomach hurt. Oh, I done had diarrhea for the last week and I want to come in on the 7th day. You know, just the drunk people coming in because everybody chilling. Stay your ass home and sit at home. Now, the bad. Listen, let me just let y'all know something. It's not a joke. It's not a joke. You know, we're starting to, the thing that I'm most scared of, people always ask me, you know, you're not scared to get the disease, you're not scared to get the virus, you're not scared to become infected, you're not scared to work with these people. Now, it's not the people that are confirmed that have it that I'm really scared of. It's the people that are just walking around out here that aren't symptomatic, that may have it, that may be contagious, or the people that have the symptoms that aren't staying home, touching different things. I'm also fearful of places that aren't properly sanitized all over, because I don't know, but the virus could probably live on surfaces for a certain amount of time, or because it's a droplet precaution, and it's not airborne, and that's why you look crazy if you walk around in these things and out in general public. I mean, you don't look crazy, but it's not spread airborne. You just breathe it in. It's a droplet precaution, so somebody has to cough and be in a certain distance of you, or sneeze, or touch themselves and then touch you, and different things like that. So it's the people that are unknown. I'm fearful of the unknown, actually. Also with, a lot of people out here right now that do not have work. Now, it sounds good for the first couple days. Oh, I get to work from home, or they sending us home. But not everybody has the luxury of either one, being in the healthcare field and having, a stable income. Not everybody has the ability to work from home or have paid leave. Everybody's supposed to self-quarantine pretty much. So people at lower end jobs that don't get the benefits that a lot of other jobs get. So, a lot of people are going without. A lot of people aren't eating, aren't having 3 square meals a day, which is happening unusual. But now it's a crisis situation where people are supposed to stay inside. Kids who went to school who go to school, who depend on breakfast and lunch at school as their meals for the day. You got people, think about sick people that have to go to dialysis 3 days a week. There's a lot of geriatric population in nursing homes are also suffering because their families can't come visit them. They are cutting off. I know at the hospitals we're doing 1 visit per person, but in the nursing homes they're doing no visitors because this is such a high risk population and it spreads so fast. There are a lot of geriatric population coming into the ER because of simple things. Like I had a patient last week who basically our family came to see her every day. Either one of the family members came at breakfast, lunch, or dinner, and they fed her. Now that they are not allowed to come in and see their grandmother or their parent or a family member, she's not eating. She's not eating from the staff members. She's refusing to eat. So now there's then a domino effect of other things that are affecting her health conditions. So it's just different things like that we don't think about on a daily basis because it doesn't affect us. Facilities are having a shortage on things such as hand sanitizer, PPE mask, N95 mask, and it's putting, not only are we at risk because we're on the front line, now we're at risk because we don't have the necessary supplies and materials, and you're starting to see this burnout effect, and basically you're starting to see the healthcare system, people that work in healthcare that are starting to get scared themselves. And not only does the country need assistance, but if we're going to combat this virus and this pandemic that's going on, then we need help ourselves. We don't have the proper staffing, we don't have the proper materials to keep us safe. It's a scary thing to think about, and there's just so many things that can be affected by if things were to get worse or things that are going on right now. I don't think that we were prepared for this. I'm gonna be honest myself, I didn't take it serious at first, really because it wasn't affecting me, and now it's hitting home because it's affecting me. NBA, NFL, MLB, XFL, whatever sports you can think of, cancel. Now what are we supposed to do, huh? Now what am I supposed to do? Now please tell me, you want me to quarantine in the house for 14 days? I ain't got nothing to do. I'm running out of snacks. Come on now. In all seriousness, I want you guys to stay safe, stay healthy, protect yourselves, protect others. Now, it's called the Do 5. And these are 5 things you can do to stop the spread of the coronavirus. Now, these 5 things are: 1, washing your hands, which you should have been doing anyway. So when you leave the bathroom, every time you touch a door, basically you need to be washing your hands every 5 to 10 minutes pretty much before you touch anything. Next, coughing and sneezing into your arms, into your elbow, into your underarm, somewhere where it's not coming out to everybody else. All right? Do not touch your face. Now, we try to work on these skin care routines anyway, so you don't need to be touching your face because that's just putting you at risk to getting sick. Stay more than 3 feet away from individuals. So we're practicing social distancing. We're practicing personal space. You know what I'm saying? We're practicing just stay back there. Talk to me back here. You know what I'm saying? That way we good. Everybody practice this. Social distancing, that's what we're practicing. And we're also saying, stay home if you feel sick. It's a virus. There's really no cure for it. Just like the flu, I know they give out Tamiflu and things of that nature, but there's really no way to get rid of the virus. You know, you gotta let it take its course. You gotta let your body fight it. It's gonna be rough. It's gonna be a rough couple of days. But there's a period of incubation to where the time period between where somebody is contagious and not able to spread it. You're gonna go through your coughing, you're gonna go through your body aches and fever and chills and things of that nature. Just make sure you stay hydrated, make sure you eat something, and just let your body rest. It's not really much we can do right now, but if you just practice those 5 do's: washing your hands, make sure you cough or sneeze until your elbow, do not touch your face, stay more than 3 feet away from people, and if you're sick, stay home. You should be good, and we can limit the spread of this virus. But I'm gonna be honest with you, because I'm a realist. I think when it's all said and done, we all gonna have it. We all gonna have it, and it's gonna become a thing of the past, and then it's gonna become, okay, we got the vaccine for the virus, who want the vaccine? Now nobody want the vaccine. Just like nobody want to take the flu vaccine, because I just gonna get the flu if I, you know, all that stuff. So I just want to say from the bottom of my heart, shout out to all my healthcare workers. I don't care from the bottom up, from dietary, EBS, CNAs, GNAs, LPNs, RNs, PAs, MPs, doctors, MDs. I don't care what you are. If you're in the healthcare field, because since we are essential service workers, we gotta be at work. I don't care what the government say, because without us, nothing pretty much will get accomplished. This is no takeaway from anybody else or any other profession right now, but I just want to say shout out to all my healthcare workers. We in this together, we going through this together, and we gonna get through this together. So just make sure y'all stay positive. Make sure you stay close to your family. Make sure you protect yourself so that you can protect your family, and we can continue to get this money. Listen, better days are coming. Better days are coming. Every little thing gonna be all right, but it's gonna get worse before it get better. And we just gotta stay together.